A 78-year-old goes in for a routine checkup. Their blood pressure is reading a bit high, so the doctor prescribes medication. Over the next 6 months, those numbers come down beautifully, landing right on a textbook 124/78. The doctor is thrilled. By all standard medical guidelines, this is a total success. The patient gets a gold star on their chart and heads home feeling like they've secured their long-term health. Fast forward a few weeks. It's the middle of the night. The patient wakes up and swings their legs out of bed to head to the bathroom. They stand up, and within seconds, the room starts spinning. Their brain suddenly isn't getting enough blood flow. They reach out for the hallway wall to steady themselves, but their hand slips right past it, and they go down hard. A routine trip to the bathroom becomes an emergency room visit for a fractured hip. That means emergency surgery, 3 weeks in an inpatient rehab facility, and a permanent loss of daily independence. This catastrophic collapse is the direct, predictable result of their doctors successfully driving their blood pressure down to that supposedly perfect target. Researchers published a massive study in the Journal of the American Medical Association, tracking over 15,000 seniors for an average of 5 years to see how strict blood pressure targets actually affect older adults. This chart compares 2 distinct groups of seniors from that study: the participants who achieved the medically praised 120 over serious fall requiring hospitalization, compared to the group maintaining moderately elevated numbers between 130 and 145. The data gets worse from there. Looking at overall mortality, the death rate for the textbook perfect blood pressure group was 14% higher than those with moderately elevated numbers. Getting blood pressure under control in your 50s reliably prevents heart disease. But for anyone over the age of 75, the universally accepted rule that lower is always better is a medical myth that actively puts patients in harm's way. To understand why low blood pressure is hazardous, let's look at the mechanics of standing up. The moment you rise, gravity pulls massive blood volume into your legs. To keep your brain conscious, your cardiovascular system must fire a rapid upward pressure spike. When it fails to adjust quickly, blood pressure drops dangerously, a failure called orthostatic hypotension. In an older adult, this cardiovascular system has 3 major points of failure. The first is arterial stiffness. Aging blood vessels become rigid, much like a garden hose left out in the sun for 20 years. They require a significantly higher baseline pressure just to force liquid upward against gravity. The second failure point involves your baroreceptors. These are tiny pressure sensors in your blood vessels that instruct your brain to adjust flow when you change posture. As you age, these sensors become sluggish, completely missing the critical window to compensate when you stand. The third failure point is medication metabolism. Aging kidneys and livers process drugs much slower. A standard dose of blood pressure medication that works perfectly for a middle-aged adult lingers in a senior system, acting as an overpowering cardiovascular sedative. An older body lacks the mechanical elasticity of a younger one. It requires an elevated baseline internal pressure just to fight gravity and keep the brain supplied with enough oxygen to stay awake. Now look back at the patient from the beginning of our story. On their clinic intake form, vital signs showed a perfect 124/78, but they achieved this sitting completely still on an exam table. When they stood up in the dark, their sluggish sensors and lingering medication couldn't fight gravity. Their blood pressure went plummeting down to a terrifying 88/56 in seconds. The spinning room meant their brain was actively being starved of blood flow, directly resulting in the catastrophic fall. Because standard medical practice almost exclusively involves measuring blood pressure in a static, seated position, doctors remain completely blind to the life-threatening pressure drops happening when their patients actually move through the real world. This graph illustrates the research-backed target ranges for survival. For adults over age 75, the safe green zone actually shifts into higher numerical ranges, showing that the optimal longevity sweet spot requires a systolic pressure between 130 and 145. The clinical blind spot exists because our standard medical guidelines were established using massive trials on 50-year-olds to prevent future heart attacks. Those exact targets were then copied and pasted onto 80-year-olds without accounting for changing biology. Medical professionals need to adjust their perspective. Instead of treating a generic target number on a chart, they need to treat the specific, age-adjusted physiology of the individual patient in front of them. Moderate blood pressure elevation in seniors is rarely a disease needing a cure. It is a vital biological adaptation keeping them safely on their feet. You can protect yourself against over-medication using a highly specific, actionable protocol called the 3-minute home orthostatic vital sign test. First, lie completely flat on a bed or couch for 5 minutes to let your system settle. Then take your baseline resting blood pressure and write down both numbers. Next, stand up and immediately take your blood pressure again. Compare the top numbers, subtracting the standing systolic number from your lying systolic. If it drops by more than 20 points, you are in the danger zone. It tells you exactly what sitting quietly in a doctor's office hides. Your medication is too strong, and your brain is at severe risk. Keep a precise log of these orthostatic measurements and hand them directly to your doctor to force a conversation about setting an age-appropriate target. A 45-year-old and an 85-year-old operate as entirely different biological machines. Surviving the aging process requires questioning the medical default, tracking your vital statistics, and taking absolute control of your own data.